I don't feel well. Is this from diabetes? In this video, we will talk about how to tell whether something you're experiencing is from diabetes or not. Telling whether diabetes is the cause of something or whether your symptoms from diabetes can be extremely challenging for two reasons. First, many factors could contribute to the same problem. For example, fatigue is typically caused by many things at the same time, and diabetes only contributes, but is not the only reason for fatigue. Second, diabetes may not directly cause a problem. Instead, it indirectly causes a problem by harming some organs irreversibly. For example, diabetes can cause nerve damage, and nerve damage can cause pain in feet. However, controlling your diabetes better is unlikely to change the foot pain, because nerve damage is oftentimes irreversible. So what we actually want to know is whether the condition can be quickly reversed if blood sugar is better controlled. Now these are the symptoms that can be quickly reversed by lowering blood sugar. Here, quickly I mean in a few hours, or at most, no more than a few days. Thirsty, frequent urination, weight loss, fatigue, and if the blood sugar is much higher, you can also get blurry vision, nausea, vomiting, stomach pain, feeling foggy or sleeping. However, for any of these symptoms, it is still not guaranteed that you will feel 100% better after blood sugar is better, because any one of these symptoms can also be caused by hundreds of other reasons. Now you see why it is almost impossible to pinpoint whether anything is from diabetes. The best thing you can do is to get blood sugar better controlled and see what happens. Therefore, if you suspect something is from diabetes, the first thing to do is to get blood sugar down and see if the condition improves. If it does not improve after a few days, then it is either not related to diabetes or it is not going to be reversed by blood sugar control in the short term. Then you should continue to maintain a good blood sugar level and at the same time start to search for other reasons. Now let's look at some examples. In this first example, he feels tired over the past 3 months. Blood sugar has been over 200 most of the time. Is his fatigue from diabetes? The only way to know that is by lowering blood sugar and see what happens. So he gets his blood sugar down to about 100 most of the time, which is a very good number. But his energy level only improved a little bit. Therefore, diabetes contributes to his fatigue, but cannot be the only reason for his fatigue. Later on, we found that he has sleep apnea. It is a sleep disorder that can make people tired. In the next example, she keeps on losing hair over the past 6 weeks. Her blood sugar has been in the 300s most of the time. Is her hair loss from diabetes? Again, the only way to know that for sure is to get blood sugar better and see what happens. She was able to bring her blood sugar down to around 100, but the hair loss persisted. Therefore, diabetes should not be the direct reason for her hair loss, or at least, her hair loss cannot be reversed by better controlled diabetes in the short term. Is it possible that diabetes has irreversibly damaged her hair? No one will ever know. Regardless, she should try to maintain a good blood sugar to prevent any more damage from diabetes, and also look for other causes of hair loss. Later, it turned out that she has a skin disease called alopecia areata. If your condition deteriorates very quickly, then go to the emergency room. Don't wait. For example, if you suddenly have blurry vision and your vision was fine just a couple hours ago, then do not waste your time with trial and error, as you may likely have a life-threatening condition. Now you might ask, I want to get my blood sugar down, but what target should I aim for? You can go to hmf-diabetes.com, search what is a good blood sugar level to find more details.